What to do for akathisia caused by OCD meds. If you or someone you know is experiencing a restless feeling or an inability to sit, still after starting medication for obsessive-compulsive disorder, it might be akathisia. This movement disorder can be quite uncomfortable and is often caused by medications like antipsychotics that are sometimes added to treat OCD when other medications aren't enough. The good news is that managing akathisia involves a mix of strategies that can help ease symptoms safely. First, it's important to talk to your healthcare provider about what you're experiencing. They might consider adjusting the dose of the medication, causing the problem, or switching to a different medication that has a lower risk of triggering akathisia. Sometimes, reducing the dose or changing the timing of medication intake can make a big difference. For example, taking medications at bedtime might help lessen daytime restlessness. Lifestyle changes can also be helpful. Regular exercise, like walking or gentle stretching, can help reduce feelings of inner restlessness. Stress management techniques such as deep breathing, meditation, or mindfulness can also be beneficial in calming the mind and body. On the medication side, certain drugs are known to help with akathisia. Beta blockers like propranolol are often used because they can reduce physical symptoms like rapid heartbeat and restlessness. These are usually prescribed by a doctor and are effective in many cases. Benzodiazepines, which are medications that help with anxiety and agitation, can also provide short-term relief but are generally used with caution because of their potential for dependence. Another option is low-dose mirtazapine, a medication that blocks certain serotonin receptors and has shown promise in easing akathisia without interfering with other psychiatric medications. Some studies also suggest that vitamin B6 supplements might help, as they are generally well tolerated and have shown some effectiveness in small trials. Monitoring is key. Regular check-ins with your healthcare provider can help catch symptoms early and adjust treatment plans as needed. It's also important to educate yourself about side effects and report any new or worsening symptoms promptly. Remember, every person responds differently to medications, so what works for one person might not work for another. Always consult your doctor before making any changes to your medication or adding new treatments. Managing medication side effects like akathisia is a balancing act that requires professional guidance to ensure safety and comfort.